Well, a tug of war over the health care bill. President Obama's top health care official urging quick passage of the legislation. But as the Democrats have tried to line up the necessary votes, Republicans are saying not so fast. So are we headed to the finish line? Are we far from it? Let's bring in Thaddeus McCotter, a congressman from Michigan and chairman of the Republican Policy Committee. John Yarmuth is a Democratic congressman from Kentucky and a member of the House Budget Committee. Gentlemen, thanks for being with us. Congressman Yarmuth, I must say that every single poll, including our own, show that Americans by a wide margin do not support the president's plan, and indeed in separate polling, a majority of people would prefer no bill at all to the current bills. Are you prepared to say that Americans are wrong?
I'm prepared to say that what those polls show basically are a reaction to the Republican characterization of the health care reform measure, not the bill itself. When I have the opportunity to speak with my constituents and explain what this bill means to them, I don't have any trouble generating support for this bill. Enthusiastic support, as a matter of fact. I have this game I play now when I go before a group and I say, I'll buy anybody dinner who can prove to me that this bill doesn't help them or somebody in their family. I haven't had to pay off yet.
I must say that one of your fellow Democrats in the House said a recent poll showed 7% support in his district. He is a Democrat. Congressman McCotter, Associated Press is reporting today the president is now resorting to a kind of trust me strategy in private meetings with wavering Democrats. He's asking them to take a leap of faith, if you will. That may perhaps smack of political desperation, but it could in the end work. Might he and Pelosi get enough votes in the House to pass the Senate version?
Well, I think you hit the nail on the head, Greg. The American people do not support the bill. And the reason that it hasn't passed to date is not simply Republicans. What it is a centrist Democrats, the public, and my Republican Party have the support against the bill. People want to see targeted, ameliorative, helpful reforms that, if they do not work, can be amended or repealed, rather than some large government-run health care bill that is going to be very difficult to repeal. And so I think in their obsession to try to pass it, and despite the American people's objection, all they're really saying to the country is that they know how to run your life than you do. Americans fundamentally reject that.
Congressman Yarmuth, in yesterday's address, it was very conspicuous. I watched it 2 or 3 times. The president advocated 3 things, but those 3 things are the least objectionable. They were tax credits for small businesses so they could buy health insurance, coverage for pre-existing conditions, and children could stay on their parents' policies until age 26. Why not just start with that? They are the least objectionable. Americans want that. And maybe you can add in competitive interstate sales and portability, but why not start with the things that Americans universally are in favor of?
Well, you just mentioned the core of the bill, and the problem is, and I think the one thing that came out of the president's bipartisan session at the Blair House the week before last was the reason that you can't do this piecemeal, because it is a Rubik's Cube, and every time you move a piece, you move 10 others. It has to be comprehensive for all the pieces to work together. And I think the American people are beginning to get a sense of this. I understand, this bill has gone through so much transformation over the last year, yet the Republican talking points haven't changed a bit. It's still government takeover, government takeover. There's no government takeover here. This is using free market forces and dynamics to handle on cost and to expand coverage. This is a bill that Republicans have actually put forward, a concept over the years.
It took me, 30 seconds to mention the things in the president's speech, and his speech yesterday was only 2 minutes long. This bill, sir, is 2,700 pages. But Congressman McCotter, why not try private reform first? That is to say, something like strict government oversight, new rules on health insurance companies to control the cost. The expense on that would be 0.
What you have, again, is 2 fundamentally different views of this. That's what came out of the Blair House meeting. Is the Democrats want a government-run, bureaucrat-controlled healthcare system. Republicans want free market, patient-centered wellness. And when you talk about the law of supply and demand, it's applied to these principal positions. What the Democrats want to do is exactly as you put forward, have government control the supply of health care, expand and increase the demand. That will lead to higher costs and eventually government rationing. What you need is to have the costs come down through competitive free market principles with consumers of health care controlling their wellness. That will bring the cost down and help expand access to others.
All right, Congressman Yarmouth, let me take this a little bit of a right-hand turn.
Now with premium increases from 30 to 50% this year across the country, that free market supply and demand is really working well now.
All right,
That's
Congressman
not free
Yarmouth.
market demand. That's government intrusion into the marketplace, helping to cause those problems and underfunding of Medicare through the federal government and others.
What if, Congressman Yarmouth, the House, despite misgivings, your colleagues, passed the Senate bill on the promise that U.S. senators would thereafter make numerous changes through reconciliation, those changes demanded by House Democrats? Is there any assurance, any at all, that senators would keep their end of the bargain once the president signs the bill into law?
Well, that's something that we're going to have to decide whether we can trust the Senate. The Senate hasn't, and they know that even the most supporters of health care in the Senate know that they have not done much to earn the trust of the House. But we also have the president's representation. I would hope that he's not going to sign any of it unless these deals that have been arranged would be made.
You know what? You guys got burned in the House on climate change last year, didn't you? Huh?
We get burned all the time.
Well, so there's no issue. I mean, the president could sign the thing.
Not.
The president could sign the thing and then say, well, okay, now senators do your job. And if they don't do their job as promised, it's not his fault, so he's free and clear. You're going to trust those senators?
Well, the scenario that is actually being orchestrated is that those bills would be passed virtually simultaneously, so that the president would sign the Senate-approved bill and then sign the amendment package that was passed by majority rule within minutes after that. So we hope that they would be a coordinated effort.
Congressman McCotter, quick question. I mean, Americans, I hear this all the time in our emails, and I've read thousands and thousands of them throughout the course of the last several months. And they say one thing consistently. Medicaid and Medicare are going bankrupt, so Social Security for that matter. They don't want another entitlement program which the government will mismanage and bankrupt. Is that sound reasoning in your judgment?
Yes. First, I agree with Congressman Yarmouth that in the House, the enemy is not on the other side of the aisle. It's on the other side of the rotunda. Secondly, what I think the American people in their wisdom and practicality are saying is that an imperfect health care system cannot be fixed by having a big broken government run it.
All right. Thank you, gentlemen. Congressman Yarmouth, Congressman McCotter. Good to see you both this Sunday. Thank you.
Good to be with you.
Nice to see you.